So one of the things in our office that, a lot of other offices do as well, I'd say the majority don't. I'm just shooting off the top of my head. Maybe 10% of offices do this. But so let's say crowns. You familiar with what a crown is? Mm-hmm. Okay, so a crown, we would shave down part of the tooth, and then you put a cap over the tooth, and that's a crown, right? Looks just like a tooth, functions like a tooth, and it's whether maybe they have a big cavity or a crack or whatever it is. So with crowns, normally you prepare the crown and then you take an impression, right? And you send it to a lab, and then like 2-3 weeks later, that comes back with the crown, and hopefully in that time frame, their temporary hasn't come off. In our office, we do digital imaging, okay, which a lot of offices do digital imaging. We do digital imaging, but then we design and make the crowns right there in the office.
Oh, wow.
Yeah, so there's a lot of art to preparing the tooth for the crown, getting everything right. But then also like designing the crown, it's really cool because we get to put in, everything about it, the shape, the size, how it's going to interact with the opposing arch. So if it's a lower tooth, how it's going to interact with their upper arch, how it's going to interact with the teeth in the area. Just today, we had a patient in for a crown, and he was just really blown away, like watching his crown be designed. So I would say that's one of my favorite things is the art in dentistry, and especially now with the technologies that we have in our office, like designing our own crowns. It makes it to where we can really practice that art side of dentistry a lot as well.